So we're often asked by our patients what are some risk factors for developing arthritis, and some of them even ask, is my past history playing sports causing my knee, hip, shoulder, whatever pain you may have?
It's a good question, actually, but arthritis is a very complicated or complex disease, if you want to call it that. Genetics certainly has an influence on it. We understand that, but it's more than just that. And then the activities that a person does can also have an influence. We'll get into that a little bit as well.
So there are some sports that actually carry a higher risk of developing arthritis as you age in comparison to others. So in this video, we're going to look at a couple studies saying what the science says about it, and we're also going to show you some exercises you can do if you're suffering from arthritic pain.
Yeah, now I got to admit, the studies are revealing. They show some information that surprised me a little bit, so it's interesting, and just follow us along and we'll explain what we found.
The first study we're going to look at is called Athletics and Osteoarthritis. Now, in this study, they looked at athletes and older individuals who participated in vigorous sports activities and increased the risk of osteoarthritis. Now, these sports we're talking about are things that are high impact and also have torsional loading, meaning a lot of twisting, turning, diagonal cutting, different stuff. So some examples of this would be like soccer, football, basketball, tennis, baseball even. I mean, football's worse because you hit each other, but, high impact, full-on sports at top speeds.
All right, Mike, I agree with all those, but I don't think anybody in our viewership plays football.
Maybe Aaron Rodgers.
Well,
but who knows if he watches us anyway?
But let's look at moderate exercise. How does that affect their joints? We're talking about like walking,
jogging, resistance training, functional exercise stuff. Now, they found that does not increase your risk of osteoarthritis. It can actually improve the strength and mobility in the joints and muscles surrounding it. So we just want to differentiate that this study is looking at high impact, full speed sports, not your typical gym goer, weekend warrior person. Now, here are some other factors that can actually increase your risk of osteoarthritis that are not associated with the sports aspect of it.
Yes, this is actually oftentimes the genetic factor that will really have an effect on it. The first one is joint alignment. For example, if a person is genuvarous or genuvalgus, in other words, bow-legged or knock-kneed, that can really affect the stress points on the knee joints.
Another thing is a history of joint injury or surgery in the past, so maybe a meniscal tear playing sports, ACL, etc. Typically, those people can develop arthritis later in life.
The next thing is joint instability or hypermobile joints. In other words, the ligaments are lax. They don't keep the joint in place. Things like, they call it hypermobility, like I said. The common term is?
Double jointed.
Double jointed, yeah, which there really is no double joints. But anyways, you know what I mean.
The next common cause is above average body weight. Just having that much more weight compressing on each joint within your body can add up over the years.
Right, and general weakness. If your muscles and whatnot aren't strong enough to maintain alignment in the joint, that can also irritate and accelerate arthritis. All right, the second study we're going to look at has to do with what, Mike?
Long distance runners and looking at their development if they were higher or lower risk of osteoarthritis. So it is called Aging, Long Distance Running, and the Development of Musculoskeletal Disability, a Controlled Study. That is a really long title.
Yeah. Bottom line is I think most people think people who long distance run as they age are going to wear their joints out. Arthritis is going to happen and they're going to fall apart. Very interesting results did come from this.
Yeah, so the study actually compared 498 long-distance runners ages 50 to 72 years old.
And 365 community control subjects, in other words, people who, live their life on the average activity level.
So what they found in the study is that runners had less physical disability and maintained more functional capacity than their age-matched control subjects, meaning they compared runners to non-runners in the same demographic and found the runners were essentially moving better and in better shape.
And actually, the runners had less visits to the doctor. What is it, 1/3 less?
1/3 less visits going to the doctor.
And most of those visits were as a result of an injury from running, maybe a muscle tear, muscle strain, whatever it may
Other
be.
issues like that. So what they found when it comes to osteoarthritis, comparing the runners to non-runners group, there was no significant difference in the amount of osteoarthritis developed between the runners and the non-runners.
Now, I think everyone is not surprised about this fact, is the people who are the runners had a better cardiovascular system and health than the non-active people. But the other part that was really interesting to me is the decreased rate of disability in general. In other words, the people who are active running had less problems overall.
In their whole body, upper body and lower body, which is pretty fascinating.
Right, that's what I thought. I was happy to hear that because I like to run and I want to keep running.
So basically, the study concluded that a aerobic fitness running plan structured in a proper way did not increase the risk of osteoarthritis and oftentimes actually helped the musculoskeletal system with aging. You get some bone density benefits, some muscular benefits, some cardio benefits. Now, we should mention for the non-runners, these people are often running slower, less impact, taking it easy, and not running super hard as often. So that's why distance running is so different compared to, say, playing football.
Right. All right, now let's look outside of these studies and see how it relates to us, yourselves. How can you improve your health with movement without running? Because a lot of people, most people just do not want to run. And it's all boils down to movement and range of motion in the joints to keep them healthy. So we're going to go through some general basic exercises that are very effective for your hands and your wrists.
So movement is good because it actually produces synovial fluid in all joints of the body. We will start with the hand, but we have some other joints we're going to address as well.
Right, so should we get right into the claw?
We should. The claw exercises first. So simply take your hands up and then make a claw. You're not making a full closed fist like this yet. You're simply making a claw. So if you have any hand, wrist arthritis, these are good for that. What's the next exercise, Brad?
Tabletop. That's an interesting one. It takes a little coordination where you just do this. So you're working the big knuckle joints right here. Okay, do that with both at the same time. There's the tabletop and it straightens up.
The next one is called finger abduction, abduction, and adduction. Basically, you're just opening your fingers, spreading them apart sideways, and bringing them back together. Again, try to do 10 of them.
And then full extension. That means opening your hand to here. That's not full. We want to go back farther. You can use the other hand to add a little passive range or a little stretch on that as well. Now, oftentimes in the hand, arthritis is felt in the small joints in the fingers and the knuckles. And if you have it, you know it. I feel it. This does feel a little uncomfortable, but the more I do it, it loosens up and it feels better. Everyone typically knows or typically experiences up in the morning out of bed. Oh, it's hard to do, it hurts. And as you do these, it loosens it up, and then you do them throughout the day. Let's talk about some other exercises.
Okay, the next we're going to look at the knee joint itself. If you have some arthritis in there, sometimes just some movement can help. We're just going to simply extend or kick out straight and then flex back as far as you comfortably can. If you are limited in some capacity, you can certainly grab underneath your leg. Just do the range of motion and ability you have and then come back down. Obviously, the more arthritis you have, it might take a little while to limber it up, but the knee joint just simply straightens and bends.
Yeah, as far as straighten it, you can put it on the floor, scoot to the edge of your chair, and do a little straightening like this. This also does include the hip, particularly if you're trying to flex the knee. The hip flexes at the same time. You're getting two joints at the same time, which is really nice to do. All right, hip. Let's talk about the hip a little bit in more detail, Mike. In a seated position, you can simply, as I mentioned before, pull up like this, maximum flexion and extension on the chair. You really have to turn sideways and go like this. Mike is doing a good job standing. Talk about that a little more.
Now it comes to standing, you can certainly hold on to something if you need to, flex it up. You can also mess with which range you're in. Notice here, flexion, I can go about there. If I go slightly out to the side, I can get a little higher up, get that joint moving. When it comes to extension and standing, holding on to something works. Kick straight back, try not to bend forward. It's going to be a little more challenging, engage a little more muscles in a standing versus seated position.
Good. Next is hip abduction or adduction. That's this motion, seated position. You can simply keep your feet in one position, one spot, and go In, you're limited, obviously, by knees touching, but out, you can go farther. You get little hip muscles stretching as well as the joint moving.
In a standing position, simply kick your legs out to the side in a straight fashion like this. Hold on to something for support if needed. Try to control the motion. Good posture. Do not just sway and kick as high as you can.
Good, and then rotating the hip. In the chair, it's kind of difficult to get a really good rotation, but you can sit like this and work this way. We're getting a little rotation, or hold the knee still and swing the foot back and forth. This is internal rotation. Typically, you won't go too far that way. This way, you can actually pull here and up like you're going to put your sock on. A really good functional stretch as well.
Now, if you're in a standing position to do this, act like you're squishing an ugly bug on the ground there, and just put your feet back and forth rotating. Notice my heels are up. This helps with the rotational component. If you got pretty good mobility, you feel steady, you could certainly kind of do some hip circles. You get a full range of flexion, abduction, rotation, the hips just moving in all directions. You can go clockwise or counterclockwise with this.
There you go. So we got you some exercises from the hands, hips, and knees. If you want to have another video with some more exercises, what do we have?
You can check out the video, What I Wish Everyone Knew About Arthritis. So you can click the video link on the screen to check out that video.
All right. Thank you, Mike. Enjoy the day.
Bob and Brad, the two most famous physical therapists.